CGTN, China Global Television Network.
Hello and welcome to The World Today on CGTN. I'm Su Yuting in Beijing. We begin in Beijing, where authorities are briefing the media on China's achievements in the development of public health in the past decade. Today's briefing is part of a series of government updates on China's development since the 18th National Congress of the Communist Party of China in 2012. It comes ahead of the CPC's 20th National Congress, which convenes in October. Let's listen.
Of the CPC Central Committee. This is the 27th press conference under the theme of China in the past decade. Today we have invited Mr. Li Bin, Vice Minister of the National Health Commission, Mr. Qin Huaijin, Vice Commissioner of the National Administration of Traditional Chinese Medicine, Mr. Chang, Jile, Vice Administrator of the National Disease Control and Prevention Administration. They will brief you on the achievements in the development of China's public health since the 18th National Congress of the CPC, and then take your questions. Here with us today are Mr. Wang Haidong, Director General of the Department of Elderly Health of NHC, Mr. Zhu Hongbiao, First Class Inspector of the Department of Institutional Reform of NHC, and Mr. Du Xixue, Special Supervisor of the Department of Population and Family of NHC. Now let's give the floor to Mr. Li. Friends from the media, good afternoon. First, I would like to thank you for your long-standing care and support for public health work. General Secretary Xi Jinping has pointed out that the most important indicator of modernization is people's health, which is the foundation for a happy life. Since the 18th CPC National Congress, the CPC Central Committee, with Comrade Xi Jinping at its core, has viewed people's health as a strategic priority, putting people and their life first, and front and center. They have outlined the health strategies in the new era, elevated the tasks of building a healthy China as a national strategy, promoted health development, and blazed the path of health reform with Chinese characteristics. Over the past decade, the strategy of building a healthy China has been fully implemented, and people's health has been protected in all aspects. We have promulgated and revised laws such as the Law on Promotion of Basic Medical and Healthcare, introduced and implemented the outline of Healthy China 2030 plan, advanced the Healthy China initiative. The health-related poverty alleviation program has lifted out of poverty nearly 10 million families that were poor due to illness. Patriotic health campaigns have been integrated into all aspects of public health governance. A civilized, healthy, green, and eco-friendly way of life is becoming more popular. People's health has been markedly improved. Over the past decade, population has grown in a balanced way, and elderly care and child care has been further improved. We have refined the childbirth policy, implemented the two-child policy, and then three-child policy, lifted constraints such as social support fees, launched a series of supporting policies. We have also implemented the national strategy for addressing population aging, promoted the integration of medical care and healthcare, and worked actively to build an elderly-friendly society. The ability to ensure the safety of mothers and infants has been significantly improved. China's mortality rate of infants and that of children under 5 are far below the average level of middle and high-income countries. Core indicators of maternal and child health have been further improved. Over the past decade, institutional health reform has been deepened, and the difficulty in receiving medical services at a reasonable price has been addressed more quickly. We have abolished the old system of subsidizing doctors with selling more medicines, continued to promote the transition from putting disease treatment at the center to putting people's health at the center, accelerated the coordinated reform of medical care, medical insurance, and medicine, and promoted the three-tier network of medical services. 90% of households can reach the nearest medical center within 15 minutes. The number of essential medicines on the national list has increased to 685. More than 1.36 billion people are covered by the basic medical insurance, and the proportion of personal health expenditure in total health expenditure dropped to 27.7%. Over the past decade, the safety net for public health has strengthened, and contagious, chronic, occupational, and endemic diseases have been more effectively controlled. We have eliminated malaria, controlled hepatitis B, and the AIDS. The premature mortality rate of major chronic diseases is lower than the global average. The high incidence of pneumoconiosis and other major occupational diseases was basically curbed. The schistosomiasis epidemic was reduced to the lowest level in history. The target under the 3-year campaign to prevent and control endemic diseases was achieved as scheduled. We have stood the test of the COVID-19 pandemic. We have followed the strategy of guarding against inbound cases and domestic resurgences and the dynamic zero-COVID policy, and adjusted the prevention and control measures according to the time and situation, so that people's lives and health are protected to the greatest extent. We have also coordinated COVID response and economic and social development. Our efforts have fully demonstrated China's strengths and China's wisdom. Over the past decade, the capacity of medical workers, the level and quality of medical technologies have been improved. By 2021, the total number of health personnel in China reached 13.983 million. The scale of talent of various kinds has grown. The proportion of health professionals at primary level has reached 72%. We have built a high-quality and efficient medical service system, set up national medical centers and national regional medical centers, strengthened the development of medical associations, and comprehensive medical reforms in counties. 50% of county hospitals are able to carry out complex surgeries. We have encouraged the trend of addressing major diseases in the province, general diseases in cities and counties, minor ailments in towns and villages. The annual per capita number of medical consultations, hospitalization rate, and other indicators gradually approach the average level of developed countries. Over the past decade, TCM has enjoyed innovative development and has been carried forward to make it more accessible and reliable to the public. We have sped up the building of a high-quality and efficient TCM service system, significantly improved TCM services at the primary level, made TCM more equitable, accessible, and convenient. promoted Chinese medicine to the world, reaching 196 countries and regions. Over the past decade, health science and technology enjoyed rapid progress with more in-depth and broader participation in global health governance. The new drug campaign has promoted the leapfrog development from imitation to innovation in R&D. Special campaigns has been carried out to improve our ability to address emerging infectious diseases. We have actively participated in global health governance, made solid progress in the development of the Health Silk Road, continue to carry out foreign assistance on health, and did our best to provide assistance to the international community. All these have demonstrated our responsibility as a major country in building a global community of health for all. In conclusion, the past decade has witnessed the greatest progress in China's health and a growing sense of health gain for the public. Life expectancy rose from 76.8 to 78.2, marking a historic jump. Major health indicators are among the highest in middle and high-income countries, and Chinese people's right to health is fully protected. This speaks volumes about the people-centered development philosophy that the CPC Central Committee with Comrade Xi Jinping at its core upholds. We will continue to improve our health policies and provide all-round health services for the people, so as to lay a solid foundation for achieving the second centenary goal. Next, me and my colleagues will take your questions. Thank you. Thank you, Mr. Li. Now the floor is open for questions. Please identify your media affiliation before raising questions. CCTV.
Building a healthy China is a national strategy. It is vital for people's sense of fulfillment, happiness, and safety. And the 14th Five-Year Plan and Long-Range Objectives 2035 have put forth the goal of building a healthy China by 2035. How are the targets being met, and what benefits have been delivered to the people?
I'll take your question.
Well, building a healthy China has received a lot of attention. As we advance this program, we have made efforts on the following areas. Well, first, the CPC Central Committee and the State Council take people's health very seriously. They put people's health at a strategic priority place and made the important decision of building a healthy China by 2035. We have earnestly implemented the decisions of the CPC Central Committee and the State Council, and we worked with relevant departments to implement the necessary measures. The main targets for 2022 in building a healthy China have been achieved, advance of time, and the initiative has gotten off to a good start. First is to mainstream public health, and the system of policies for health have been basically put in place. We have set up relevant committees for expert consultation and for taking actions. We also set up an evaluation system for assessing the health impact and enabled coordination between different departments and provinces. Second, we are also raising awareness among the general public and put in place two pools and one mechanism. We have put in place the pools of experts and pools of resources for health knowledge awareness raising campaigns, and in all media mechanism for health awareness raising has also been established. Third, we pay attention to the whole cycle, and the capacity for maintaining health have been raised. The per capita subsidies for public health services has been raised to 84 yuan. We have also provided public services, health services to key demographics, including pregnant women, old senior citizens aged 65 years and above, and also young children. We have also effectively contained major diseases. The premature mortality rate of major chronic diseases are also lower than global average. Fourth, people's lives is healthier, and the production and the living environment are being improved. People's health awareness level has been raised to 25.4%. The area of sports venues is on the rise, and as many as 37.2% of people often participate in sports activities and fitness activities. Urban living environments have been improved, and air quality is also on the rise. The rural areas has taken on a new look. Access to tap water and clean toilets is steadily increasing. Fifth, we also encouraged participation of all the general public. There is a growing sense of awareness for building a healthy China. We are promoting the idea that everyone is primarily responsible for their own health, and we have created a good social atmosphere for pursuing health and staying healthy. Next question, please.
中国青年报记者提问：医改是一个世界性难题，请问深化医改是如何推进的？
China Youth Daily. Healthcare reform is a global challenge. What progress has been made and what experience has been accumulated? I'd like to invite Mr. Zhu Hongbiao to answer this question. Thank you for your care and attention to the healthcare reform. As you mentioned, healthcare reform is a global challenge. For China, a country with 1.4 billion people, it is even more difficult and challenging. Since the 18th CPC National Congress, we have followed the top-level design of the healthcare reform, focused on key difficulties and areas. And we focused on accumulating resources in cities like Sanmin, address people's difficulties in receiving medical treatment, and achieved a lot of progress. First, the difficulty in receiving medical services has been addressed. We have set up a number of medical centers and regional medical centers, and 15,000 medical consortiums. In 2021, the first batch of national regional medical centers have been established, and people have greater access to medical services. Second, people can now receive medical services at a more reasonable price. We have removed the added value on medicines and other equipment. We have promoted the collective purchase of medicines and other medical equipment and reduced 50% of reduced the price on 50% of the drugs. Third, we have taken a health-oriented reform approach. We put prevention at a more outstanding place, implementing the Healthy China initiative so that the philosophy of people making responsible choices for their own health is more popular. We have also made good use of the TCM, combined medical care and healthcare, and innovated our way of providing medical services. In this process, we've become aware that we must uphold the leadership of the CPC, put people front and center, follow a systemic approach, make coordinated efforts on medical reform. Next step, we will continue to bear in mind our national conditions, address the difficulties in medical reform with Chinese wisdom. Thank you. Next question, please. Southern Metropolis Daily. Over the past 10 years, we have made adjustments to childbirth policies many times. How do you view China's current population situation, and what measures will be taken in promoting balanced development of population in the future? Thank you. I'd like to invite Mr. Du Xixue to answer this question. Population development is one of the top priorities of the country. Since the 18th National Congress, bearing in mind the strategic task of the rejuvenation of the Chinese nation, the CPC Central Committee, with Comrade Xi Jinping at its core, has made major decisions in accordance with the changes of population in China. For example, we have implemented the two-child policy and the three-child policy, and other supporting policies. The proportion of births of a second child or more has increased from about 35% to over 55%. The sex ratio at birth gradually returned to the normal level. The prenatal and postnatal care has been improved. Universal care services got off to a good start, with policies, regulations, standards, and service supply systems basically in place. Supporting measures have been improved to effectively reduce the burden of childbirth and parenting on families. In the new era, the total fertility rate is at a relatively lower level, and we face unbalanced development among regions, and in response to people's expectations, we will take marriage, childbirth, parenting, and education into consideration, and vigorously develop universal childcare services, and to ensure the smooth realization of the goal of population development in the new era. Next question. Macau Daily.
TCM drugs are the foundation of TCM development and continuation. What is your assessment of TCM development over the past 10 years, and what is the future development plan? Well, TCM is very important, and today we have with us Deputy Head Minister Chang of the National Administration of TCM to our press conference, and I'll give this question to Minister Chang. Well, that is a very important question. Over the past 10 years, we have seen the best period of TCM development since the founding of the People's Republic. As you said, TCM drugs are the foundation of TCM's innovative development. Thanks to the support of the government, the quality, the innovation of TCM has been growing with a good momentum. That is why the TCM industry has been growing rapidly, relying on the state key labs and National Engineering Research Center and other platforms. We have been actively promoting cooperation between the manufacturers, academia, and researchers, and we have implemented relevant programs to strengthen quality control of the manufacturing of TCM and also upgraded the relevant facilities in producing TCM and promote green and smart development of the industry. Now we have focused on commercialization of TCM and also promoted the TCM industry, which is growing with a sound momentum. Statistics show that the income of TCM industry has increased from 515.6 billion yuan to almost 700 billion yuan last year. The quality of TCM is also increasing and improving. We carried out the 4th National Survey of TCM resources, and we have made breakthroughs in domesticating wild TCM resources and finding their alternatives. We have also expanded the scope of using TCM. We have also introduced planning programs for planting TCM herbs and materials to strengthen the source management of TCM materials. And among the survey conducted by the National Medical Products Administration, 98% of the TCM decoction pieces being surveyed are safe and effective. The NMPA and relevant authorities have increased input in developing TCM to ensure high quality of the TCM and also to strengthen R&D of new TCM drugs. We have also put in place science-based approval system to increase the clinical experience so that our approval will be based on sound evidence. And this would also give dynamism to the TCM industry. And going forward, we will earnestly implement the 14th Five-Year Plan for TCM development and the major project for continuation and innovation of TCM, promote plantation, manufacturing, and innovation of TCM, and highlight technical and scientific support, promote high-quality development of TCM, and meet people's needs for TCM drugs. Thank you. Next question, please.
A question from the Straits Times. So this is a question about COVID-19. And given that it's been nearly 3 years since the pandemic started, is the country's current dynamic zero COVID policy at odds with economic growth? And how long more can we expect dynamic zero to continue? And furthermore, since over 90% of the Chinese population is now vaccinated, can we expect a timeline for the country to move towards living with the virus? 与病共处. Thank you.
请翻译一下。
您好，我是来自新加坡海峡时报的记者。我们知道，现在距离新冠疫情爆发已经有3年的时间了。中国当前的动态清零政策是否与经济开放相冲突？动态清零还会持续多长的时间？既然已经超过90%的中国人民已经接种了疫苗，中国是否打算改变政策与病毒共处？是否有相关的时间框架？
好，谢谢。这个问题啊
Thank you for your question.
国家这个疾控局副局长常继乐先生。
I'd like to invite Mr. Chang Jile to answer this question.
非常感谢这位记者朋友的提问。
Thank you for your question.
动态清零政策呢
The dynamic zero COVID policy is based on the early detection of minor symptoms to improve the ability of prevention and early detection of COVID-19. quickly detect infected people and the epidemic, to immediately address the cases one by one. With this, we are able to bring infection under control in the shortest time and at the lowest social cost. General Secretary Xi Jinping has stressed the importance of targeted prevention and control, and that we must strive to achieve the biggest results at the lowest cost, and minimize the impact of the pandemic on economic and social development. This requirement from the central authorities is unchanged. As for the cost of the prevention and control policies and measures, we should bear in mind the whole country, its economic and social development, and people's livelihood, and the country's overall interests. Our philosophy on prevention and control measures is about putting people and their life first. Our aim of these measures is to minimize the impact of the pandemic on economic and social development. These measures may cause some inconvenience to normal production and life, but we must bear in mind the overall interests of the country. In infected areas, we have taken targeted and strict prevention measures to ensure normal production and life in most parts of the country and the stability of the supply chain. So in general, our prevention and control measures are most effective and efficient. We are faced with a pandemic unseen in a century. The current pandemic is still at its height, and the virus is still mutating. Our understanding of COVID-19 is still increasing, and face a lot of uncertainties. The risks and threats brought by COVID-19 still exist. We must have unwavering strategic resolve to balance the relationships between short-term and long-term partial and overall goals. Adjust prevention and control measures according to time and situations. Coordinate COVID-19 prevention and control with economic and social development. This is a basic requirement and a realistic choice based on science. Thank you. Next question, please. National Business Daily. Over the past 10 years, our public health has stood the test of major infectious diseases like H7N9, MERS, Ebola, COVID-19, and the test of earthquakes, floods, and other natural disasters. So with all these previous fights against public health emergency, what progress has been made in health emergency response capacity? I'd like to invite Mr. Chang to answer this question. Thank you for your question. Health emergency response capacity is the embodiment of comprehensive health strengths. Over the past decade, relevant departments and localities have worked together to strengthen and improve health emergency management, focusing on health emergency response system and core capacity building. In order to enhance the capacity of the health system to respond to emergencies, and also contribute to global public health security. First, the health emergency response system is basically established in China. After years of efforts, the legal system of health emergency response has been basically established. the management system has taken shape. The capacity has been significantly improved. In 2014, the target under the national health regulations was achieved as scheduled. Second, the core capacity of health emergency response has reached the global advanced level. China has put in place the world's largest online direct reporting system for infectious diseases and public health emergencies, shortening the average reporting time for public health emergencies to 4 hours, and is now capable of detecting more than 300 pathogens within 72 hours. A public health risk assessment system for emergencies has been established, and China has set up 59 national health emergency teams in 4 categories. Third, prevention, control, and response to public health emergencies is conducted in a scientific and efficient manner, focusing on the source of infection, route of transmission, and susceptible population. We have strengthened the prevention and early warning measures, improved the rapid response capacity, and ensured the effective handling of the incident. The total number of public health emergencies and the number of deaths have decreased. Major outbreaks have been brought under effective control, especially H7N9 and other new infectious diseases, and MERS, and other imported cases and diseases. China has also made international contributions to controlling Ebola and achieved major strategic achievements in the prevention and control of COVID-19. We will focus on the response to COVID-19, coordinate prevention and control of diseases and emergency medical relief, and further enhance our emergency response capacity to better protect people's health and contribute to building a global community of health for all. Thank you. Next question, please. 21st Century Business Herald.
The communities are the foundation of our healthcare system, and the capacity of community-level health institutions have a direct bearing on people's access to healthcare services. How has the capacity at the community level progressed in terms of providing public health services? Thank you for your question. Strengthening the community-level institutions has always been the top priority of our work. In recent years, the capacity of the grassroots level in preventing and treating diseases and health management has been improved. First, the healthcare network at the community level has been basically fully established with greater availability of services. By the end of 2021, there were nearly 980,000 community-level health institutions, 35,000 township clinics, 599,000 village clinics, and 36,000 community-level health service stations. Second, the capacity in providing services has been strengthened and with greater recognition among the people. In 2021, the community-level health mechanisms provided 4.25 billion services, accounting for 50.2% of national total. Third, there is a significant increase in the number of community-level health workers with improved personnel mix. Over the past decade, the number of community-level health workers increased from 3.437 million to 4.432 million. And the proportion of certified doctors among the village health workers increased from 18.5% to 41.5%. Now, the services provided by contracted household family doctors have been advanced steadily. There is greater communication between the doctors and the patients, and awareness-raising efforts have been strengthened. Fourth, we have raised the quality of public health services at the grassroots level. The subsidies for basic public health services per capita has been increased from 25 yuan in 2012 to 84 yuan. The programs carried out at the community level have been expanded from 10 categories to 12 categories. And we have provided over 1 billion healthcare management services to key demographics, including children at age 6 and under, pregnant women, senior citizens at 55 years old and older. These programs have contributed a lot to the enhancement of health of residents at urban and rural areas. With Haibao News, the health of women and children has always been close to people's hearts. What measures have been taken over the past 10 years to improve maternal and child care, and what are the new steps that will be taken to ensure their health? I'll give this question to Mr. Du. Thank you for your question. The death rates of pregnant women, infants, and children at the age of 5 and under are the core indicators of maternal and child health. It reflects the public health of a country or region. It is also the important indicators for assessing a country or region's economic and social development. In 2021, the maternal mortality is 16.1 per 100,000. Infant mortality is 5 per 1,000. And the death rate of children aged 5 and under is 7.1 per 1,000, down by 34.3%, 51.5%, and 46.2% from 2012, respectively. At this stage, our maternal mortality is far lower than the medium level of medium and high-income countries, and infant mortality rate and death rate of children aged 5 and under are also lower than the average of medium and high-income countries. We have been recognized by the WHO as one of the 10 top performers in terms of maternal and child health. And for the new era, we have taken some new measures. First, Maternal and Child Safety Action Plan and the Healthy Children Action Plan have been put in place. Second, we will launch the action plan to eliminate mother-to-child transmission of HIV/AIDS, syphilis, and hepatitis, and also the plan for eliminating cervical cancer. And third, we will promote the action plan to encourage breastfeeding, to forge closer bonds between mother and children.
China is becoming an aging society. With aging population growth, various health needs will also increase. What's China's plan and measures regarding this? Now, I'd like to invite Mr. Wang Haidong to answer this question. Thank you. We all have elderly in our home, and thus responding to the population aging matters to everyone and also the interest of the nation. China has a large number of aging population, and this trend is going faster. there is also different situations in different regions. The 14th Five-Year Plan period will witness a transition from a low level of population aging to a mid-level population aging. We will work on the central authorities' decisions on addressing population aging and implement the national strategy of actively responding to the population aging and integrate it into the whole process of economic and social development and build a social system of care for the elderly. And implement in full our favorable policies for the elderly and promote the virtues of respecting and caring for the elderly so that the elderly population can enjoy the outcomes of reform and opening up and enjoy a happy life. Healthy aging is the cheapest and most effective way to deal with population aging. During the 14th Five-Year Plan period, we will follow the plan on population aging during the 14th Five-Year Plan and work on the following fronts. First, we will strengthen preventive health care. We will implement the elderly care promotion measures and projects on oral health, nutrition improvement, dementia prevention, and psychological care will be conducted for the elderly so as to improve their ability to actively pursue health and avoid getting ill often and early and prevent serious diseases. Second, we will improve medical services for the elderly. We will advance the establishment of geriatric medicine in general hospitals at level 2 and above and achieve the goal of 60%. We will also enhance rehabilitation and nursing services and implement a number of measures that make medical services more accessible to the elderly. Third, we need to carry out long-standing support for the disabled elderly. Our care for them is most important. We need to evaluate their health conditions and provide the whole chain nursing care for them. Make sure that the services can be delivered to the primary level so as to reduce the burden on the family and the society. Fourth, we will deepen the integration of medical care and health care. This is highly popular among the elderly. Next step, we will continue to integrate medical resources, increase medical services supply, and enhance the team of the elderly care, and provide both rehabilitation and medical services. Fifth, we will strengthen healthcare for the elderly. We will strengthen the development of geriatric medicine and related disciplines, increase the training of professionals in this area, promote geriatric health technology and industrial development. In conclusion, we will focus on promoting education, prevention, treatment, care, hospice treatment, and other areas to protect the elderly's health and increase their sense of gain. Thank you. Zhejiang Daily.
We know there is a great demand for TCM drugs, and how do we bring TCM services better to the general public? Are there any good prescriptions for that? Thank you for your question. As you rightly said, since TCM services are very convenient and accessible, they are safe and effective, so they are very popular among the general public. In recent years, the National Administration of TCM has also given priority to strengthening the capacity building of providing community-level TCM services. We have initiated the program to provide better community-level TCM services so that the general public can benefit from such services. First, we will keep improving the community-level TCM service network. We have supported the establishment of 36,700 medical TCM stations, and a lot of the cities, and more than 90% of community-level health service stations, and 99% of community-level health service center now are able to provide TCM services. Second, we will further strengthen the development of community-level TCM teams. We have been strengthening training for young TCM teachers and provide better occupation services to enable more high-quality doctors to work at the community level. By 2020, there were 0.66 TCM general practitioners per 10,000 urban and rural residents. 82.4% of community health service stations had at least one TCM physician or clinical physician capable of providing TCM services. And third, we will popularize the appropriate techniques of traditional Chinese medicine at the community level. We have established 32 provincial-level bases and more than 1,820 county-level bases for the promotion of TCM techniques for common diseases. Now, community health centers and township health centers that could provide more than 6 types of TCM techniques accounted for 86.04% and 81.03%. And we also provide services, assistance, and training to the community level health centers. And going forward, we will continue to implement the decisions of the CPC Central Committee and the State Council, continue to leverage the strength of TCM, strengthen the capacity building of TCM service providers, and to provide better services to the general public and play a more important role in promoting TCM services.
谢谢主持人。
Beijing News. We noticed the NHC's data on the performances of level 3 public hospitals. Data shows that most hospitals have different degrees of improvement over the original level, and regional differences are shrinking. But there still exists unbalanced and inadequate allocation of resources. My question is, what has been done to improve the allocation of resources, and what changes have been made? I'd like to invite Mr. Zhu Hongbiao to answer this question. Thank you. Promoting the capacity, expansion and balanced distribution of high-quality medical resources is a powerful means to address insufficient total medical resources and uneven regional distribution. Over the past decade, the NHC has further promoted the development of a tiered medical system and taken multiple measures to build a new pattern of orderly medical treatment. First, we have increased financial input and increased the total amount of medical resources. During the 13th five-year plan period, China has arranged 108.96 billion yuan to support medical services and its supply, 72.2 billion yuan on universal healthcare project, 14.58 billion yuan on public health prevention and control treatment capacity building project, in order to strengthen the building of medical institutions, especially county hospitals. The consultation rate of common and frequently occurring diseases in counties exceeded 90%, compared with 2011. The number of medical facilities has increased by 8%, beds by 83%, and health personnel by 62%. Second, we have increased the capacity of high-quality medical resources and promoted balanced distribution among regions. During the 14th five-year plan period, we will build about 120 provincial regional medical centers so as to deliver medical resources to remote areas and narrow their difference with advanced areas in the country, and reduce the number of cross-provincial of patients receiving medical treatment in different provinces. Third, we have built a tiered medical system focusing on the construction of medical consortiums. We have carried out trials of tiered medical treatment in 4 municipalities directly under the central government, and 317 prefecture-level cities, and the trials of medical consortiums in 118 cities in 32 provinces, and county-level medical consortiums in 827 counties. By December 2021, the number of two-way referrals had reached 28.8 million. The structure of two-way referral had been significantly improved. Medical resources and services have become more reasonably distributed and coordinated. Beijing Youth Daily.
In 2021, we won a complete victory in fighting poverty, and they also mentioned the healthcare program for poverty alleviation, which is a key step for fighting poverty. So what are the specific measures to prevent people from falling into or back into poverty due to illness? The health authorities have been earnestly implementing the health care program for poverty alleviation, and we have helped nearly 10 million households forced back into poverty by illness to shake off poverty and made important contribution to the fight against poverty. First, we have fully fixed the inadequacies in terms of rural health institutions and personnel. To meet the goal of ensuring basic health care, we strengthened accountability at every level sent medical teams and experts to the rural areas and for the first time in history addressed the shortages of medical facilities and doctors and basically achieved fair access to basic healthcare services for the rural population. Second, the service capacity of county-level hospitals in those regions have achieved leapfrog progress. We have focused on the capacity building of county-level hospitals and encouraged 1,007 Grade 3 hospitals in urban areas to pair up with 1,172 county-level hospitals in 832 counties, so that each of these counties would have at least one public hospital and 98% of the counties would have at least one Grade 3 or above hospitals. So the gap between urban and rural areas has been narrowing. Third, we have been implementing targeted health measures tailored to individual needs. We have organized more than 800,000 health workers for a full review of the health conditions and provided tailored treatments to the poor patients so that they can receive tailored medical services and treatments. By the end of 2020, a total of 20 million people have received treatments. Fourth, we have made historic progress in preventing and controlling diseases in major areas. We have implemented the campaign against major infectious diseases and endemics, major diseases such as HIV/AIDS, hereditary disease and endemics have been under effective control. Graduating from poverty is not the end of the story, but the start of a new journey. We will ensure there will be no more backsliding to poverty because of illness, and to ensure full coverage of rural basic public health services and enhance the service capacity and level of providing rural public health services and contribute to greater health of the rural population. Science and technology daily. In the fight against COVID-19, vaccine R&D has not only enabled the Chinese people to use their own vaccines, but also enabled vaccines to be provided globally as public goods. So, what kind of role has vaccine R&D played in fighting the epidemic? Starting from 2008, the NHC has led two major special programs, one on developing new medicine and the other on containing infectious diseases. We have used our strengths of a whole-of-nation system and led our scientific and research teams in a race to the top, and achieved major outcomes and breakthroughs in public health. In recent years, we have approved 80 Category 1 new medicines for commercial use, a 16-fold increase from before the special program. And China's R&D of new medicine has achieved leapfrog development in embracing innovation and strengthening the pharmaceutical industry. And our country's capacity has seen a clear improvement in the diagnosis, prevention, and treatment of major infectious diseases. In the fight against COVID-19, within 1 week, we identified the coronavirus, separated the strain of the virus, completed the genetic sequencing, and shared it with the rest of the world. The WHO highly recognized our efforts in identifying the pathogen in record time.
在疫情爆发的2周内，
Within 2 weeks of the
研发
COVID
了
outbreak,
高敏感性
we
和特异性
swiftly
的新冠病毒核
developed
酸检测
the
技术，
highly sensitive and
为早期诊
specific
断
COVID-19
阳
nucleic
性
acid
感染
testing
者
techniques, which
筛
played
查
a vital
发挥
role
了至关
in
重要
early
的作用。
diagnosis and in
我们组织
identifying
了优势
the
团队进
infected.
行疫苗
We
研发
have
攻关，
organized
首创了
a strong
全球
team,
首个
put together a
高
strong
生物安
team
全
to work
风险
on
疫
the
苗
vaccines,
生产车间
and
技术
we
标准，为后续
created
的
the world's
新冠病
first
毒疫苗
high
几十亿
biosafety
的
risk vaccine
安全
production
量产
technical
打下了
standard,
坚实的
laying
基
a
础。
solid foundation
我
for
们
the
组织
safe
了对药物
production
的
of
临
billions
床
of
前研究、
COVID-19 vaccines
抗体的
that
筛
have
选、
come after.
临床试
We
验、通道
also
打通和
put
快
in
速审批
place fast tracks
推
for
动了综
developing
合
and
抗体、化药和中药
approving
等成功上市。
preclinical trial studies, the
医学
selection
科
of
技工作者
antibodies
一
and
直奋战在
clinical
疫情防
trials,
控的第一线，
and
展示了医学
encouraged the
科技
rollout of
和教育队
neutralizing
伍的
antibodies
良好
and
作用。
TCM and other medicines.
我们将
The
继续
health
落实
workers
健康
and
中
the
国战
scientists
略
have been
科教兴国
working
战
on
略
the
和
front
创
line
新
of
驱动发展战略，
COVID-19
围绕
and
关键技
of
术
the fight against
和科学
COVID-19. They
难
have
题
demonstrated their professionalism,
为卫生健康事业
professionalism,
发展提
and
供
we will
有
continue
力
to
的科技
implement
支
the
撑。
strategy of building a healthy China and provide
好，
strong
谢
scientific
谢
support
各位
for
发布人。
public
谢谢
health
各位记者
development
朋友。
in China.
今天的发布会就到这
My
里。
thanks go to
再见。
all the speakers and all the journalists. With that, we conclude today's press briefing. Thank you.
That's the live signal we have for you from Beijing, where authorities have briefed the media about China's achievements in the development of public health sector over the past decades. And the officials have answered questions from media on a variety of issues, including the child care policies, traditional Chinese medicine services, and also China's mortality rate for children and life expectancy, and also COVID-19 control measures and health emergency response, and the population aging issue, and so on. And you know that the strategy of building a health China has been implemented since 2012. And this press conference has just sent out a very clear signal that China attaches great importance to people's health and also put people's health as the strategic priority. And for more on that, we're now joined by Zhao Dahai, a professor at the School of International and Public Affairs at Shanghai Jiao Tong University. Welcome to the show, Professor. China has addressed several childbearing policies to promote long-term and balanced population development, including the 3-child policy. So what other tools do you think they have in this box?
Actually, there are really a couple of new policies for implementing the 3-child policy. For example, as far as I know, a large number of new kindergartens will be established in the near future in many cities. The previous investigations have shown that one of the major obstacles of implementing the 3-child policy is the lackage of kindergartens. Besides of the new plan of the increasing the number of kindergartens, some other measures for helping the parents to take care of the new babies also have been considered. In addition, the 3-child policy has also been related with the considerations of the reforms on maternity insurance and housing policy, etc. In word, Chinese government tries to promote the long-term population development.
Well, Professor, more than 1.3 billion Chinese people are covered by basic medical insurance, and the proportion of personnel health expenditure in the total health expenditure in China has decreased to 27.7%. So how is that compared with other economies?
The proportion of personal health expenditure in the total health expenditures in China has been decreased dramatically during the last about 20 years. It is one of the major achievements of China's health system reforms. Further, of course, all Chinese people have benefited from the decrease. It's not easy to compare the proportion of personal health expenditure in the total expenditure in one country between China and other countries. For example, the United Kingdom implements the free health expenditure for all residents. That is to say, it's not necessary for residents in the United Kingdom to pay the health expenditure if they visit the public hospitals. The United States implements the commercial health insurance system, even though the proportion of personal health expenditure in the total health expenditure is very low if people have bought the health insurance. However, more than 20 million people in the United States have no health insurance. They have to pay the health expenditure by themselves.
Well, Professor, the impact of the COVID-19 pandemic on China's economic and social development is currently a major concern. And the question has also been raised during the press conference that on the China's dynamic COVID-0 policy. So do you think China will keep its current pandemic prevention policies?
My answer is yes. In terms of the dynamic zero COVID policy, I believe China will keep it. First, the characteristic of the current COVID-19 virus is spreading very, very fast. If China did not implement dynamic zero COVID policy, a large number of Chinese people will be infected in a very short period of time. Considering there are more than 260 million people who are about 60 years old, it would lead to a large number of severe cases and fatal cases for the old people. Second,
Okay, Professor, as the time is so limited, thank you very much for your insight. That's our Professor Zhao Dahai from the Shanghai Jiao Tong University. Thank you very much for your time and your insight. That's it.